sunshine. It's our sunshine.
Hi everyone, I am Dr. Vimalakar Reddy. I am a consultant surgical gastroenterologist at Sunshine Hospital, Secunderabad. Today we are going to discuss about the acute abdomen, emergency surgical conditions, emergency pain abdomen which will lead to the surgery. So usually there are two important conditions like perforation, a hole in the intestine, or obstruction to the intestine, means acute intestinal obstruction. So today we are going to discuss about the acute intestinal obstruction, means the tube got, the intestinal tube got obstructed somewhere. What will happen? This is a tube system constituting stomach, small intestine and large intestine. If you got obstruction in any tube, narrowing of any tube, what will happen? So it causes proximal dilatation. So proximal dilatation means the patient will have a bloating, distension of the abdomen. Then after some time it will cause lot of vomiting, projectile green colored vomiting, and there is obstruction, there is no content in the distal intestine, distal tube, so that will cause there won't be any motion, and they won't even pass the flatus also. So if somebody is having abdominal distension with vomiting with complete constipation or obstipation, that is considered as obstruction. So why we have to do surgery? How to diagnose? With the simple X-ray we will see, and we will see where is the obstruction. For that we have to go for the CT scan. In normally, why obstruction will happen? Common problem in ladies is surgery. So they will go for either tubectomy or cesarean sections or sometimes hysterectomy. So what will happen after any surgery? If you open abdomen once, the chances of adhesion formation between the intestines itself or intestines and the walls of the stomach. So because of that adhesion, some band, what will happen? Slowly it will go into narrow. At one point of time it will go into obstructive stage. After any surgery there is a chance of adhesion formation and the chance of acute intestinal obstruction developing chances. But if it is going into the acute stage, not into the subacute stage, usually we'll go for the immediate surgery. Apart from that, in India, because of TB, the TB will cause lot of, intestinal TB will cause lot of stricturization, which will cause acute intestinal obstruction. The third common cause is the cancers in the intestine, or if it is small age group, it will be intussusception, means tube into the tube. Usually weaning of time from the 6 months to 2 years, usually there will be hypertrophy of some lymph glands, or sometimes polyp, sometimes some lipoma will cause tube in tube. The patient will have a lot of vomiting, abdominal distension. In that situation, we will go in, we will relieve that obstruction, or sometimes we have to go for the resection. And the last thing about the cancers, usually after 40 or 45 years, if somebody is having obstruction, we will suspect the cancer, commonly in the large intestine. It can be from the cecum to ascending colon to transverse colon to descending colon, sigmoid and rectum, anywhere it can be there. If the cancer is there, what we will do in emergency situation, we'll go, usually we'll try to take out that cancer with the proximal and distal normal part, and if possible we will anastomose the two tubes, and if it is not possible we will go for the ostomy, means we will keep the intestine out. With that, the motion will comes into that bag after 3 months based on the treatment. If it is non-cancerous, usually we will go for the closure after 3 months. If it is cancer, after completion of the chemotherapy and based on the condition, sometimes radiotherapy also, we will go for the closure. So if somebody is having abdominal distension and vomiting, constipation within a span of 24 to 48 hours, it can be ranging from the simple adhesion to cancer, anything can happen. So immediately consult the doctor, we will diagnose with the X-ray and CT scan, then based on the condition, most of the times, 95% of the times, we have to go for surgery within hours to resect the part of the intestine, and based on the condition whether to anastomose or keep it out, we'll decide. Why we should not wait? Because if you wait, the whole intestine will go into the gangrenous status, or not only gangrenous status, with the gangrene it will form a perforation. Again, there will be hole in the intestine which will cause the add-on problem like peritonitis. So obstruction and perforation, there is a bad combination, the outcome will be very poor. So that's why less than 24 hours you should consult the doctor and go for the surgery. Sometimes the cause for the acute intestinal obstruction may be hernias, inguinal hernias, incisional hernias and umbilical hernia. Any hernia, usually the content will be either omentum or small intestine or large intestine. So the intestine, whatever goes in, usually it goes out and comes into the abdomen, but at one point of time it will go and get twisted and it will go into the obstructive stage. So when it is obstructed, immediately we have to go for the surgery, because if you take up for the surgery early, we may avoid the gangrene, dying of that intestinal part. If it is normal, we will push in, we will repair with the mesh. If it is gangrenous and that intestinal part got damaged, we have to go for the resection. We will take out that part, and based on the condition, either anastomosing, connecting the two tubes, or keeping out, we will decide. So even hernias, that's why when it is normal only, we will advise for the surgery, because we don't want that to go into the stage of obstruction.
Sunshine, it's our sunshine.